Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. In this episode, I have the pleasure and privilege of having Alayne here to share her journey of becoming a coach. Alayne Morena is a dedicated registered dental hygienist and holds a Bachelor of Science in Health and Wellness. With a passion for holistic well-being, Alayne has extended her expertise to include certifications as a certified international health coach and a certified gluten-free practitioner. Recently, she has become a national board certified health and wellness coach. Beyond her certifications, Alayne Morena is committed to a holistic approach to wellness. Her dental hygienist background, coupled with a deep understanding of health and wellness principles, positions her as a comprehensive guide for those seeking transformative health journeys. I had the pleasure of meeting Alayne and helping her prepare to become a national board certified health and wellness coach, where she shared her journey of becoming a coach. Alayne, thank you for being here to share this journey with fellow coaches.
Thank you, Jessica. I was very honored when you asked me to speak.
How did you first learn about coaching?
Way back in 2015, 2016, I had found a holistic nutritionist who then had me work with their health coach. And then as things kind of went through 2020 and the whole COVID, not knowing if we could ever go back to the dental hygiene life, I started looking a little bit more into becoming a health coach.
What made you decide to go for it? And from your decision of starting looking into it to then actually go ahead and pursuing the training?
I think I just didn't want to be stuck in an office. I wanted to help people all the way around, not just dentally. And I think that kind of was a driving factor for me to be able to do remote work and help people all at the same time.
I can't even imagine as a dental hygienist, when you come in and you see patients before they see the dentist and while they're seeing the dentist, and obviously you're there and you're working on oral hygiene, but there's so much more that I imagine you must see that goes into it when patients actually get a chance to talk to you.
Absolutely. There are a lot of oral manifestations that occur. Acid reflux is your primary. A lot of people are dehydrated, and some of the different medications, how they present within the oral cavity. So you can spot those and be able to question a little bit deeper than just, are you brushing and flossing?
I love that about the holistic approach, and coaching kind of enables us to do that, right?
Yes,
Because there's so much compartmentalization and specialization in medicine, which is necessary. But in zooming in so much, we often forget to look out at the bigger picture and what is going on holistically.
that is so true.
What was your journey of becoming a coach? So, did you decide to do this in 2020?
I did. In October of 2020, I enrolled in the Institute of Integrative Nutrition and I took the year path. And in 21, I had graduated and then went right into the coaching intensive so that I would be able to sit for the national board.
And why did you choose to become a national board certified health and wellness coach?
It is the gold standard. And if you look at a lot of job boards, LinkedIn, everybody seems to need that. And coming from a dental hygiene background, I am licensed. I have credentials, and anybody can call themselves a health coach, but I think it raises the bar for people so that they know that you're thoroughly qualified and you hold the standards that are set.
And like you mentioned, it really is a significant effort. You said your coaching program, maybe it was a year. Programs vary in duration, but the process of becoming certified is extensive, which is wonderful, right? Like you said, to ensure that standard.
Yes.
How is your experience actually taking the certification exam?
My journey in taking the exam was a little different. My boyfriend had passed away a few weeks prior to. I was not in the right mindset. As I sat down with that weighing on my head, the electricity went out in the test center. So a truck had hit a telephone pole, so we had no power for 45 minutes. So the anxiety that I had currently bringing in on top of now I have to sit and wait, not even knowing if I would be able to finish the test that day. So it was the first time I had taken the test, I did not do so well because my mindset was not there.
I just want to honor your courage and for sharing and
No, thank you.
just your authenticity. So thank you for that. And I can't even imagine, it's so hard in any field, especially you know this as a dental hygienist, when you work in a health and wellness field, whether you're working with patients or showing up for a certification exam, we are expected to perform a certain way, either
Yeah.
academically or clinically, regardless of what's going on around us. And
Yes.
that is so hard to do with the loss of a loved one. I can't even imagine what you went through.
Thank you. Thank you for your compassion. Yeah, you leave your stuff at the door and you just keep moving on. And I think it triggered me when there was no electricity that I was really not in the right frame.
What happened afterwards? You obviously went through this really trying experience, everything leading up to the exam and then the exam. And then you found out that, okay, it didn't go so well. Where did you go from there?
I took some time off to think and see where I really wanted to go from there. And I know very quickly from the November testing to the March testing is quick. I knew that that was not going to be something that I could do mentally. So came the first of the year, I decided that I was going to sit for the November boards. And I just started reading all of the necessary competencies and the books that associated with those competencies. And I just dove deep into every test review question. And I just kept going through it until I finally found your course. And then that was very close to the testing. And it was definitely putting a better seal all the way around, making sure that I knew exactly what I needed to know for the test.
That kind of effort and dedication is tremendous. And I wanted to ask, what kept you going? How did you motivate yourself to put in that kind of effort? What motivated you to do that?
The inner tenacity that I have. At the time I was studying for the exam, I was also finishing my bachelor's degree and taking statistics. So it was just internal drive, internal motivation that I finally got my bachelor's degree, and that was like a grudge match for me. And this was, I was going to take the second test, and whatever was in the works for me, whether I passed it or not, at least I knew I had put in such a valiant effort that whatever it was going to be.
And so it sounds like it was really important for you, regardless of the outcome, that you really gave it your best effort.
Absolutely.
Reflecting on your journey now and everything that you had gone through, what was your biggest takeaway from it?
That at first you don't succeed, you have to keep trying. I had the knowledge, and I think at the time I didn't have the confidence. And I think that was, working on myself, making sure that I knew what I needed to do and to be grounded and keep moving forward. And I don't think I would, had I passed the first time, I don't think it would have been as sweet for me to get where I am. I think the journey had to be the journey that it was. I did a lot more studying the second time. I don't think I was as mentally or physically prepared the first time. And I think it was a wake up call.
For coaches now who may be listening to this who might be retaking the exam, what would you say to them?
You got this. Everybody has trained. You've gone through your schooling. It doesn't matter what schooling you've gone through, you got it. And you just have to keep your confidence that you're going to make it. So if you think it's the end, don't, because it's not. Your journey will be your journey.
Oh, that's so beautiful. Very well said. Very coach like.
Thank you.
How was your experience the second time? So, like, even just your experience taking the test after having gone through just even the experiential trauma of what you had gone through the first time around.
I think I was a lot more confident. I took a lot more time. I wrote down different questions that I was kind of on the fence about so I could revisit them, making sure that the answer was the most correct answer. And I think I just kept repeating, "You got this. We're good. You got it." Thankfully, I got it, and here we are. But I think the confidence is the biggest.
It's amazing how powerful mindset is.
Absolutely. Absolutely.
And that's kind of ties in with a holistic approach to health and wellness, right? Really addressing thought processes and mindsets underlying everything.
Yeah, and I think you can talk yourself out of something, even if it's good. You could say, "Oh, I'm not gonna pass," and go in with that mindset, or go in with that positivity and say, "Hey, I got it, and I'm gonna make it."
And it just changes your whole experience.
Absolutely. Absolutely.
Where do you see your professional coaching career taking you from here?
I've got my own business, and I am working with clients. I also help with a functional nutritionist, Dr. Karen Thomas, and I see a lot of her clients and coach them as well. So, collaboration, and we share. If I see something, I refer to her. If she sees something, she refers to me. And so it's really a beautiful thing. I think most health coaches, you have a why. Why did you get into health coaching? My why was I was misdiagnosed as lupus when it was really a food sensitivity. And those are polar opposites. And they kept saying, take your medication, you're fine. But the symptoms just kept increasing. But nobody was looking at why. And looking at the overall, you're outside the window looking in, thinking, I can help this. I know how to help you because I've been there. And I think that's the biggest thing for me is the knowledge and the experience. I don't want other people to suffer like I did.
Can you share a little bit more about what that journey was for you from being misdiagnosed and navigating that situation?
I had started with some joint pain. So as a hygienist, it's could be detrimental. I went to an orthopedic who said, you've got a little arthritis, but it doesn't match your symptoms. Sent me to the rheumatologist who said, I have lupus. I have a lot of inflammation. My Epstein Barr was over the top. I had Lyme disease. You name the autoimmune, I was the queen of having it all. So I ended up taking the medication, doing what they asked, and I kept getting worse and worse and not feeling well, sleeping, brain fog. And then finally, I was enough, uncle, I can't do this. So I managed to find a functional nutritionist who said, stop the dairy, gluten, and eggs, see how you feel. And I did that, and it was like, oh my gosh, I feel great. So I've been on that diet for some time. If I truly had an autoimmune disease, I didn't want to dismiss that. So I went to a rheumatologist, tested, and she said, here's your medication. And I said, what's going on? And she said, oh, you tested positive in 2015. Now it's 2021. So we have to treat you as if you're positive. I said, it was the food. She said, I know, but you tested positive. Here's your medication. She wasn't even listening to, if you saw how my blood work from then to the blood work now, it was like stark night and day. And I had not been on medication for years. It's just amazing how sometimes you get dismissed. And I'm just grateful again, tenacity, making sure that I was making the right choice for me.
I really appreciate your candor and sharing your experience because it's so hard with our medical system. We refer, which is what we're trained to do, and we're so lucky to even have access to specialists where
Absolutely.
most people in the world don't. But then, as you mentioned, unfortunately, we're armed with medications, and rather than the emphasis on the lifestyle and the holistic approach, and it has so much to do with the way our system is set up.
Yeah.
And so having this knowledge of knowing that regardless of if it's health promotion or whatever the entity is or symptoms are, all of these lifestyle things, like you were talking about diet, all of these things can enhance health in any situation.
Yeah.
And so just you have the medical background as a dental hygienist, you're aware of these things and you took a change. You took steps to change.
Yeah. And it wasn't easy to change and to buck the system, if you will. But I think if you're not your own advocate for your own health, nobody's going to fight for you. They're just going to treat you for your symptoms rather than for what is really going on, the root cause.
So I appreciate your sharing your experience as a healthcare practitioner, as a dental hygienist with your healthcare provider background about what it was like being a patient, because as respectful as we are to be for the healthcare system, there are obviously a lot of gaps.
Absolutely. I'm not dismissing the medical community. If you need an antibiotic, you're going to take an antibiotic. But there are sometimes a lot of diet and lifestyle that needs to, if nobody asks you what are your sleep like? How much water are you drinking? And all of these things can be resolved that way with diet and lifestyle, absolutely. But, if you need medication, there is enough of a space in the medical community for everybody to share.
And to have that knowledge to advocate for yourself.
Absolute patient autonomy.
Yeah. And that's the beauty with health and wellness coaching, right? We're not here to diagnose or provide treatment or medical advice, but that bridging the gaps and really figuring out, having the client, like you figured it out, figured out what in your life needed to change, how you wanted to go, and the role of coach to be able to do that and to help support their clients, like you said, working with their doctors, but also advocating for themselves. Really, really having health and wellness coaching be a form of advocacy.
Sure. And autonomy as a patient.
Sure. How do you find that this experience that you had influenced your decision to want to be a coach?
As I kind of dove deep into health coaching, it really helped me see from the other side, see from the client side. I could put myself in their shoes, and yet now I can help. There's more help for me. I don't really have so much of a niche, if you will. I just want to help people feel better. I want people to ask their doctor questions if they're not getting the help that they need and they're not being answered in the way that they want to be answered or helped. Let's figure it out. Let me help you figure it out. What is driving? If you've got no sleep, your brain fog, what's going on and how can we fix it so you feel better?
For coaches, healthcare providers, health and wellness professionals listening to this podcast episode, what's your message for them?
I think we're starting to be heard. There are a lot more health coaches out there. I think the more people that are certified and educated, you have a wealth of education and knowledge that you need to share. I love sharing it with people. Not only my journey, but the vastness of what we know and how all of these things are interconnected.
It's so beautifully said. That's the take home message, too. It's hard, in any medical training, there's so much education that comes with it. Physicians work so hard and go through so much, and unfortunately, it's just the structure of our system and the gaps in the system. And so, my biggest message, just listening to you, is the part for health and wellness, for advocacy, and the proactive role that each one of us, whether you're a coach or someone being coached, we all have to be proactive to really optimize our health and well-being, just in life and in the
Absolutely.
system we're in.
Yes, definitely. Definitely.
Thank you so much, Elaine. Thank you for listening. I appreciate you and value your feedback, so please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.registereddentalhygienist.com. centerforhealthandwellnesscoaches.com, sending you warmth and light.